Welcome, dear viewers. Today, we embark on a journey through the often misunderstood world of pulsatile tinnitus. This condition, distinguished by a rhythmic ear sensation that pulses in harmony with one's heartbeat, possesses a unique character different from the continuous ringing typical of tinnitus. It's not just an oddity, pulsatile tinnitus could be an alarm signaling more significant health issues. Stay tuned as we delve deep into this compelling topic, understanding the nuances and addressing the concerns it raises. Let's begin our exploration by understanding what pulsatile tinnitus truly is. Characterized by a thumping or whooshing sound that seems to follow the rhythm of an individual's heartbeat, this condition represents a subjective experience of hearing one's own circulatory or vascular system at work. Whether it's a constant companion or an occasional unwelcome guest in one's auditory experience, it's a condition that can affect either one ear or both. As we progress, we'll discover more about its symptoms and implications for personal health. What does one feel when faced with pulsatile tinnitus? Individuals report a rhythmic noise, mirroring the beat of their heart, often accompanied by sensations of pressure, dizziness, or hearing changes. The intensity of this noise can ebb and flow, but it often becomes more intrusive in the still of the night or while one is lying down. It's the kind of condition that can spiral, a source of anxiety that intensifies the more one tunes into it, creating a cycle of stress and escalating symptoms. As with many medical conditions, myths about pulsatile tinnitus abound. Contrary to popular belief, it is not just a peculiar but harmless ailment. It could be a harbinger of a grave health issue. It doesn't play favorites with age. Young and old alike can be affected. Nor is it a condition that's likely to vanish without a trace. Without intervention, symptoms may persist or even escalate. It's crucial to shake off these misconceptions and seek professional advice if you encounter symptoms like these. To comprehend the intricacies of pulsatile tinnitus, we must first appreciate the anatomical ballet of the ear. Comprised of outer, middle, and inner segments, the ear is an intricate organ. As sound waves traverse through its parts to ultimately be decoded as sound by the brain, a crucial cast member in this drama is blood flow. Sufficient circulation is vital for the ear's function and health. Any disruption in this delicate balance can lead to issues, potentially like the ones seen in pulsatile tinnitus. Hearing is no simple feat. It's a complex operation engaging various structures of the ear. The journey of sound begins as it enters the ear canal, moves to the vibrating eardrum, and is then amplified by the ossicles. The next destination is the inner ear's cochlea, where hair cells transduce these vibrations into electrical signals that the brain can process. A symphony of hearing, all made possible by the coordinated efforts of the ear's components. But without proper blood flow, this symphony could quickly fall into discord, leading to issues such as pulsatile tinnitus. A key player in our hearing process is the eustachian tube, a slender passage ensuring the balance of pressure across the eardrum, essential for sound transmission. Trouble arises when this tube is obstructed or dysfunctional, resulting in discomfort, hearing reduction, and sometimes, pulsatile tinnitus. It's fascinating how the interplay of such small parts governs the magnitude of our hearing capabilities. We will see that these structures don't operate in isolation but are highly susceptible to blood flow and pressure changes. Blood pressure is more than just a number, it's a vital sign of our circulatory system's health. Normal blood pressure is essential for delivering blood throughout the body, including the ears, without overburdening the vessel walls. On the flip side, abnormal blood pressure can spell trouble, not only for our overall health but also for the delicate workings of our ears. In the next segments, we'll dissect how blood pressure interacts with ear health and what consequences may arise from its variations. Let's break down blood pressure. It's the pressure your blood exerts against vessel walls, influenced by heart rate, blood volume, and resistance in the vessels. More than just keeping the body's tissues well oxygenated and nourished, maintaining an optimal blood pressure is central to a whole host of body functions, including hearing. But what happens when blood pressure deviates from the norm? That's when we potentially encounter health challenges, some of which can manifest in our ears. High blood pressure, also known as the silent killer, can wreak havoc on the ears. The heightened pressure can precipitate arteriosclerosis, a literal hardening of the arteries, compromising the delicate vasculature of the ear. This can diminish blood supply or even cause hearing impairment. Furthermore, the turbulent flow of overpressurized blood can lead to the sensation of hearing one's heartbeat in the ear, a signature trait of pulsatile tinnitus. Elevated blood pressure impacts more than just the vessels. It can exert force on the eustachian tube and the eardrum. The result? Increased pressure, congestion, and that uncomfortable fullness in the ear. Disturbances like these can thwart the eardrum's normal vibrations, leading to hearing impairments and, potentially, the rhythmic beats of pulsatile tinnitus. It's a chain reaction, starting from the heart and resonating out to the complexities of our auditory system. A critical aspect in the narrative of pulsatile tinnitus is identifying its root causes. High blood pressure may be the usual suspect, causing that peculiar heartbeat sensation in the ear. Yet, there are more players in this plot: vascular abnormalities, heightening intracranial pressure, or specific tumors. Unraveling the true cause is a story that requires careful investigation, for it is with this knowledge that we can chart the path to effective treatment and relief. Hypertension emerges as a critical offender in the saga of pulsatile tinnitus, manifesting its symptoms in the very pulse of an affected individual's ears. As blood pressure climbs, the cadence of blood flow near the ear changes, leading to that characteristic pulsating noise. This ties back to the importance of vigilance around blood pressure levels and seeking medical guidance to manage the condition effectively, a topic we'll soon dive deeper into. However, hypertension isn't the sole antagonist in our story. A host of other vascular issues can be behind pulsatile tinnitus, from atherosclerosis with its arterial plaque buildup to the intricate tangle of blood vessels found in arteriovenous malformations. These conditions alter the patterns and qualities of blood flow in proximity to the ear, shaping the pulsatile auditory experience. As we continue, we'll learn why addressing these vascular concerns is paramount in the overall management of pulsatile tinnitus. The rhythmic beating in your ears may not be the drumming of an unwelcome tune but rather a clarion call to investigate possible underlying health issues. Symptoms that manifest alongside pulsatile tinnitus, like dizziness, hearing loss, or unexplained headaches, could all point to hypertension or other vascular conditions requiring medical intervention. It's this proactive approach to diagnostics that can prevent dire consequences and place you on a trajectory towards improved health and quality of life.